pattern of a normal menstrual cramp. A mild pain that begins either 1 to 3 days, reaches the peak 24 hours after your cycle commences, and 2 to 3 days after this pain stops. Hello viewers, you are welcome to Peptic Ulcer. Today we will be discussing a very serious matter, which is menstrual cramps. Yeah, menstrual cramps. You know, it's something that is very common. As long as you are a lady, you are a woman, it's a common experience. Yeah, something that everyone experiences. It is very common. So guys, if you want to know more about menstrual cramps, what can be regarded as a normal menstrual cramps, when you need to get help, what you need to do, all you need to know about menstrual cramps, menstrual disorders, please guys, stay tuned and let us learn. So guys, before I begin this video, I would like to ask a very simple question. Do you think all menstrual cramps are normal? Are all menstrual pain normal? What do you think? What exactly is your thoughts? Well, before we go into that, what exactly is menstrual pain? Yeah, so menstrual cramps, you know, they are a form of pain that occurs in the lower abdomen during menstrual periods. It's as simple as that. It's just a form of pain. It's a lower abdominal pain that a woman experiences during the menstrual period. Probably in another video I would also try to make a video on menstruation, you know, everything that surrounds menstrual cycle, how to calculate your menstrual cycle, you know, how to predict your menstrual period. All those things, we'll discuss it in a separate video. But today, for the purpose of this video, we want to actually know that, okay, are all menstrual cramps normal? What could be classified as normal menstrual pain? When can you say, oh, this menstrual cramp is abnormal? And when you need to actually seek help to prevent future complications. So if you are a young lady, you are a middle-aged lady, or probably you are elderly, as long as you have not yet started menopause, please, this video is for you. It is for you. So what are you doing? Please subscribe, please subscribe, like, share and comment. Thank you. So like I said earlier, you know, menstrual cramp is a form of pain, and this pain, some could be mild, some could be moderate, some could just be annoying, and some could be very severe. It could sometimes be a very chronic pain. Menstrual cramps, it is also referred to as dysmenorrhea. Yeah, that is the medical term. Some of you might have also heard the word dysmenorrhea. It's all referring to a menstrual pain, menstrual cramps, the same thing. So, you know, this menstrual cramp that occurs during period, for some people during their menstrual period, they don't even experience any much pain, probably just a little discomfort, and then they just go through their normal activities. But when you have a form of menstrual pain that is very severe, you know, and then this pain is a pain that you are enduring, you know, for certain days in a month, becomes a monthly pain, and then it rolls into year, you are having it every year, and then it just continues like that. Sometimes some people, it is unbearable. Some people during this period, they can't even do any of their daily activities. They can't go through their daily activities of daily living. It interferes with their life, you know, the quality of life is impaired. Some people during this period, some people get hospitalized, some people get admitted. You know, some ladies, they take so many NSAIDs, non-steroidal anti-inflammatory drugs, just to combat this pain and get a form of relief. You know, that is why I just wonder that, oh, why can't we just you know, discuss this issue, look into it, and, you know, look for ways of how we can actually prevent these things and actually get medical help and prevent some certain complications that could actually be attached to this menstrual pain. Because one thing about dysmenorrhea is that when dysmenorrhea is too much, when it is excessive and you are bearing this pain days and it's happening every month, recurring, and then it rolls into years, what actually most females don't know is that it could be a point to some underlying health conditions in the reproductive tract. It could be pointing to some underlying health conditions in the reproductive organs. And if it is left untreated, some of these things you just need a small treatment and then you'll be fine. And if you don't get treated and all you are just doing is to take pain reliever, you are just taking strong pain relief drugs, and that is what you are just doing over the years, you are not treating the real cause. It could damage this underlying disease that is going on that you don't know. What you are just seeing is the pain. It could actually lead to some chronic damage in reproductive organs, which later on it could lead to complications like infertility. And what actually motivated me to come and speak on this particular topic is that some females, they don't know that they actually have some problems with their reproductive organs until years after, when they got married, and then they are trying to conceive, and then they are now looking at it that they cannot conceive, it's taking them time. I thought conception should just be something easy as long as they are menstruating and all, and then they discover that months, years after, they could not conceive, and later on when they now go for medical help, they now discover that they actually have a chronic condition. And this condition did not just happen one day. It has been there right from their teenage years. It has been there right from probably their early adulthood and all, just that they did not pay any attention to it. And then they will now refer it back, do you have severe menstrual pain? And they will say yes. Some people will now say, like when I was in secondary school, I always have a serious menstrual pain, that the pain will be so much I wouldn't have to go to school. Some people miss classes. And what do you use for this menstrual pain? Do you take any help? They say, I just used to take Felvin. This pain is not released by Tylenol. Even if I take paracetamol, it doesn't relieve the pain. So what they do, some people say they take diclofenac. Some people will say, I take ibuprofen, I take Felvin. Some people even say they take more double dose. I'll be like, what? You are taking double dose of a non-steroidal anti-inflammatory drug for menstrual pain, and you don't think that something could have been causing this pain beyond the pain you are seeing? Probably there is another serious condition, and people will not even go and seek help. Some people will be taking herbal drugs, herbal concussion for menstrual pain, and it's no good. Later on, maybe years after, they will now discover that their reproductive organ is actually the major issue that is causing this pain. Some people, they take Buscopan and long service, all this NSAID, just to get relief without treating the underlying cause. So now, are all menstrual cramps normal? The short answer is no. Once you have menstrual pain that is severe, this is sick. So I'll try to explain how we can know if a menstrual pain is normal or not. So normally, what causes this menstrual pain is contraction. Every month in the cycle, females menstruate. That is when there is no fertilization. The uterus needs to shed its lining. So the shedding of the lining of the uterus, that is what actually happens in menstruation. And as this lining is being shed, the uterine wall contracts. There is a form of contraction, and the culprit hormone here is prostaglandin. It is the one that actually causes the contraction, and then while this is going on, we feel some lower abdominal pain. Actually, this pain is not meant to be severe. You don't feel it as something mild, like this pain is just known as there is contraction, something is going on in your uterus, right? So you will feel a form of discomfort, you will feel the mild pain, and this pain should have a pattern. Usually, This pain, some people might experience this 1 to 3 days before their cycle commences. So you might begin to feel some discomfort in your lower abdomen, your pelvic region, just about 1 to 3 days before your period starts. That is normal. And some people, it's just that day they begin to feel this discomfort, this pelvic pain down, and this pain sometimes is radiate to the back or to the thighs. It's completely normal when you feel this discomfort in your lower abdomen, your pelvic region, radiating to your back or to the thigh. Is normal. So this pain can start 1 to 3 days before your cycle. Some can start on that day, and this pain, it starts gradually, and then about 24 hours after the start of this period, when you begin to see your menstrual blood, just about 24 hours after this, then this pain can reach the peak. It started gradually, then increases, and 24 hours after the commencement of this menstruation, then the pain reaches the peak. That's when you really feel the height of the pain, when it is much. And then after 24 hours, this pain should begin to reduce. It reduces gradually to the second day, then the third day, and then depending on the length of your cycle, this pain should then stop on that. That is the pattern of a normal menstrual cramp. The mild pain that begins either 1 to 3 days, reaches the peak 24 hours after your cycle commences, and 2 to 3 days after, this pain subsides gradually. That is the normal cycle of menstrual pain when the uterine wall tracks. And for this pain, for some people, you might not need to take anything. Maybe you just exercise, just take some long meals, just try to take a shower, maybe a long shower, just to relieve yourself and get some comfort. For some people, that's all. You don't have to take any medication. And for some people, they can just take, Tylenol, and they're good. But when the pain now becomes so severe that, okay, some people might have to take some NSAID, but it's not often. It's not like every month during your menstrual pain you have to take ibuprofen. No, it can be occasional, yes. But when this pain now becomes so severe that every time you're on your period you have to take NSAID, you have to take Tylenol. Not Tylenol. You have to take NSAID. You have to take ibuprofen. You have to take diclofenac. You have to take all these strong non-steroidal anti-inflammatory drugs. Some people take every month. Some people even take double dose throughout that menstrual period. You have to take the pain. And some people, the pattern of the pain, some people, the pain starts some people don't even feel pain initially, and when the pain is meant to subside, maybe 2 or 3 days after the cycle, that's when the pain now becomes intense. Like this period is already stopping to deal with, has reduced, and that is when the pain is now becoming severe. Then you have to notice. Some people would have even finished the cycle, and then this pain is still so much, and the pattern of the pain, they are feeling like it's a form of, maybe the pain is a form of wrenching pain. They are just feeling as if the pain is really throbbing. They cannot go through their daily activities. They have to think anything. At this point, you really need to seek help. Get some medical investigations, do some tests to know if there is any underlying cause behind this pain. You need to clarify it. So that is when you need to really seek help. If the pattern of your pain is not normal, if towards the end of the menstrual cycle is when this pain is now becoming so intense, and this pain you are feeling it as if probably this pain is like a form of, how can I describe it? It's throbbing, it's a form of numbing pain. This pain is just so severe. So at that point, you need to seek medical help. Reach out to your healthcare provider, reach out to your doctor, to really know what is on. And some people, they have this menstrual pain all right the months. Even after the menstrual period, they still have this pain. During ovulation, they have this severe pain. You need to seek medical attention. Yeah, you need to go to the hospital. And why did I say that you need to seek medical attention? When this menstrual cramps are not normal, usually it could be that there is actually an underlying health condition. And some of these underlying health conditions, number one, it could be infection. It could be that there is infection in the reproductive tract. Yeah. And this infection, it is the one that is actually affecting the organs, affecting the tubes, the fallopian tubes, the uterus, and this thing is actually causing you to experience this severe pain during your cycle. And another thing you also have to note is that if your cycle, your menstrual cycle is irregular, if you are having certain irregularities, it's not regular, it's not coming normally, you also need to seek attention, because it could be that, okay, probably this infection is what is affecting your cycle, or is what is causing the pain. Sometimes this pain, most times, this infection, we call it pelvic inflammatory disease, that is the PID. Most times it is caused by sexually transmitted bacteria um diseases, majorly sexually transmitted bacteria. Yeah, that is what actually caused this pelvic inflammatory disease, although it could be caused by certain infection, but the most common cause of PID is sexually transmitted disease. So if you know that, oh, you are the type that you know the lifestyle you are adopting and all that, you need to seek medical attention and also try to prevent it. Stay safe. You can just try to stay safe and abstain from sexual intercourse, unhealthy sexual practices. Just make sure that you are safe to protect yourself from all this pelvic inflammatory disease, because these things can actually lead to certain complications, and that is what I'm discussing. So things that will cause this unusual menstrual pain, it could be infection, PID. Another thing is that it could be endometriosis. Yeah, some people have this endometriosis right from the onset of their menstrual cycle, right from menarche, right from their teenage years. They already have endometriosis, but they don't know. They just be saying, oh, they are having menstrual pain. This pain has been there since when I was 13 years, 15 years. It's always more. I've been taking different herbs. People just say I've been taking different medications, and this thing has been. They are just managing the pain until they now get married and once you conceive, they are now, that's when they are now going for test. Test that you have done for even while you are a teenager, they have known that, oh, you have this thing. Then probably you just need to modify some lifestyle. Maybe you just need to modify your diet, diet that will reduce the inflammatory process in the body. Probably or you just need to be active, do some exercise and prevent all these things. This is if detected early. All these conditions, if they are being detected early, they could be prevented, they could be reversed. But if it has gone for a long time, for years, they become chronic, and sometimes they become irreversible. And some of these things, the bad thing there is that, and the dangerous thing there is that, they causes infertility. So when they now say that, oh, they cannot conceive, they now discover that, oh, the tubes are blocked, this endometriosis has already blocked the tubes, it has blocked the reproductive tract, and they cannot conceive. That is why this thing is very, very important. I've seen cases of people like that will end up being diagnosed with endometriosis and then they do not conceive. So that is why if you are a young lady, you are still in your mid age, please and please take very good attention to your body. Not all menstrual cramps are normal. If you see any unusual thing in your menstrual cycle, your menstrual period, the pain, please seek help. What you just need to do probably is just to do some, get to know, okay, is there, probably do some blood work to know there's no infection, or probably you need to do some pelvic scan to see the tubes, to see the lining, to see there is no fibroid, if there is no endometriosis, to see if all these things are actually working well. And if anything is being discovered, we try to treat it, and that will be good, and all these things will be reversed. But if it has been there for years and it has caused scaring, and all these things, it might not be reversed. So endometriosis is a reproductive health issue that occurs when certain uterine, in the uterus we have certain tissues that we have in this uterus. So when similar tissues that are similar to these uterine tissues, when they develop or when they grow in other areas of the reproductive tract, that is what causes endometriosis. So endometriosis happens when similar tissues to the uterine tissues, they grow in certain parts of the body. It could be in any other area, but most commonly in certain area of the reproductive organ. So normally these tissues are supposed to grow in the uterus. But when they now grow, most commonly, sometimes they grow in the fallopian tubes. Sometimes they grow in the cervix. They grow outside of the uterus. So all these particular tissues, they develop and they begin to form a form of inflammation in all these areas, and sometimes they can lead to a form of scarring. They form scar tissues in the fallopian tubes, and they can block the fallopian tubes. And when once the fallopian tube is blocked, fertilization cannot occur, and then it makes conception to be very, very difficult to achieve. So that is why this endometriosis is a very chronic illness. It's a very chronic condition, and the major symptom of this endometriosis is serious menstrual pain. So that is why take close attention. Some people already have it, but they did not know. And if discovered early, you can actually get some treatments that could help you to reverse it and prevent blockage of the fallopian tubes. So endometriosis is a very, very serious one. Another thing apart from the infection, endometriosis, is fibroid. Fibroid as well. It can also lead to serious pain, and sometimes this pain also comes with menstrual periods, with menstruation, feeling serious and menstrual pain. It could also be the fact that probably there is fibroid. And also when you note an unusual bleeding, probably before your menstrual cycle you do it for 3 days, and before you know it, it's turning to 5 days, 6 days, 7 days, and then you are having a form of heavy bleeding, or even the cycle is just so disrupted, it's irregular, you don't understand it, please seek help. It might be that probably it is endometriosis, it could be fibroid, it could be adenomyosis, it could be any other conditions of the reproductive organ. And these things, if detected early, they can be treated, they can be prevented, and it can actually be reversed. Whatever damage has been done, if it is detected early, over time the damage can be reversed by the time they are going through treatment. But if you do not detect on time, if this thing has occurred for years, some of these things can be irreversible except some divine intervention. So that is why for us as female, we need to take a very good and close attention to our health. That is why I say, I have to talk on this topic. Please, as a teenager, as a young girl, you are not yet married, and you know that you are seeing unusual pain during your menstrual cycle, your menstrual period. Rather, during your menstrual period, you are having severe pain that that this pain, you can't even do anything. You have to miss work, you have to miss classes, you have to change your normal day schedule, you have to take very strong pain relieving drugs, and you see that the pattern of your bleeding is unusual, you are having irregularities, you are having heavy bleeding. This is the time for you to reach out to your medical provider. Reach out, let them know what exactly is causing it. Is there any underlying cause? Do you need to get any treatment? Is it infection? Is it anything? Do scan, do anything. Just try to query whatever can be queried, and get some investigations and know what is wrong, so that you can actually act on it promptly and then prevent any future damage. That is it. And also, as a lady, for you to also reduce your menstrual pain, even when you have the normal one, and you also want to improve the quality of your health, you want to improve the quality of your life, you want to reduce the pain, also adopt healthy lifestyles. Make sure you have a healthy weight. Take note of your diet, eat good food, nourishing food, and then cut down on intake of foods that are that have high sugar contents. Cut down on junks, empty calories. You have to cut down on those things, so that you can make sure that you have a healthy reproductive system. Also, cut down on the intake of pasta and flour products. Fine, you can take egg, all this meat pie, purple, but it should not be something you take often. It's not really good for reproductive organs. So cut down on your intake of pasta and flour made products. So that is it, guys. That is it on menstrual cramps. If you have any other clarifications, you want to make anything, do well to reach out to me. If you like this video, if you benefited from it, please do well to give it a thumbs up, like it, share it with your friends, share it with your ladies, anyone you know outside there. Share it, subscribe, like and comment. Thank you. I will see you in my next video.